Dear friends, we have Dr. Sridevi with us. Today, let's learn from her about hypoglycemia, that is, the blood sugar becoming less. Over to Dr. Sridevi, please.
Thank you. So many of us know what is diabetes, that's the blood sugar is higher. But what is very important is when the blood sugar gets low, that's known as hypoglycemia. So low means, as we already said, a normal blood sugar is between 90 to 110 milligram per deciliter. When it goes less than 70 milligram per deciliter, we call it as hypoglycemia or low blood sugar. So in whom should we be more careful is in people with diabetes. When the blood sugar is not controlled properly, suddenly the blood sugar may be 400, and so when the blood sugar is not regulated, it's not controlled properly, they might have episodes of hypoglycemia. So how do we know whether they are going for hypoglycemia? What symptoms do they have? So sometimes they will be confused, they don't know what they are talking. Then they may have blurring of vision, their vision may not be clear. Then they will have palpitation, the heartbeat may be irregular, the pulse may be a little fast or it may be a little weaker. And most importantly, they will have sweating and they will be very hungry. Sometimes they may have giddiness. So due to giddiness, they may even have, sometimes they may fall also. And these are some of the minor symptoms. But what the most severe symptom is, it may suddenly lead to they may even go into coma. So that's why we are so worried about hypoglycemia. And it commonly occurs in diabetes and who are on certain medications. So what we should know is we should be aware when we take a tablet or when we are on insulin that there's a possibility of hypoglycemia. So always it's very important to have any chocolate or a biscuit or anything sweet, because that increases the blood sugar rapidly. We want the blood sugar to be higher at that point of time. So this is what is hypoglycemia, and with the blood sugar level monitoring we can identify this. And the treatment is you give the glucose, that is in the form of sweet or a juice, and immediately you ask them to, if somebody in your house suddenly falls, you should think whether it's a diabetic, you should think whether it's because of hypoglycemia, and so you can just give them a glass of sugar water, so that would make them better. So this is about hypoglycemia.
Yeah, as told by Dr. Sridevi, it's one of the main issues the patient with diabetes. Sometimes what can happen, they want to control diabetes. They take the medicine, but they don't take the food properly. They think, I'm not overeat, something like that. Then they don't eat the food properly. What can happen? Suddenly the blood sugar can drop. Sometimes even with the food taking properly, the blood sugar can fluctuate. As he said, it's a very dangerous condition. Immediately it has to be treated. That is why the rapid sugar, like chocolate, juices, that will be better. Sometimes even they have to rush to the hospital where they give intravenous glucose. By glucose overloading to that time is not going to be any kind of issues or problem. So always a woman with diabetic or patient with diabetic, they have become unconscious or very giddy. You have to think of hypoglycemia and treat with some sugar or glucose. Once they become all right, you check the sugar, then you can find out the other causes. It's very important condition patient to be aware in case of diabetes. And I really thank Dr. Sridevi. Thank you.
Thank you.